Good morning, ladies. Today's episode is about the smallest thing I'll be talking about, which is something that measures 150 nanometers. Today's latest processors are made using 5.3 nanometer technology. And here we have something that is 150 nanometers in size. What will I be talking about? What will I be talking about today? I will be talking today about the HSV, herpes virus. What is it? Viruses, herpes is already known to everyone, and it most commonly appears on the lips. It's said that infections can occur as a result of kissing. We might not focus too much on this topic today. Instead, we will deal with the genital herpes virus, also known as type 2. What's this virus all about? This virus causes infection a very large part of society. I think this is mainly caused by, with dirty hands, simply somewhere this virus has to pass through. Saying that it only spreads through sexual contact is a huge oversimplification. I would say it this way. Everyone who goes to the restroom should basically wash their hands with soap at least twice to get rid of any bacteria, viruses, fungi, and other substances before touching their genitals. And only then should they start taking care of their physiological needs. Unfortunately, that often doesn't happen. Often no one even washes anything at all, meaning they might just wipe themselves, use toilet paper, or not touch things, leave, touch the doorknob, go to the next doorknob, then the next person comes in. Even if, let's say, she had clean hands before, just one touch of a doorknob is enough to transfer those viruses. And then, of course, someone might feel an itch, scratch themselves, and that leads to the transfer. The virus may not be that dangerous. It doesn't cause, for example, congenital defects during pregnancy. It can, of course, lead to inflammation in very severe, rare cases of the brain, central nervous system, or to inflammation of the retina. But these are rather cases that I can say I haven't heard about too often. The most common issue with the herpes virus is inflammation, labia minora, vestibule, vagina. And it comes to this, we find out this way that suddenly something starts to hurt. The most clinically significant symptom is definitely pain. Everyone thinks it's some kind of infection, that someone has bacteria or fungi, but unfortunately it's the herpes virus. This herpes virus, which is quite large for a virus, 150 nanometers, but at the same time very small. It is not visible with only with an electron microscope. At most it can show us this virus. It has this kind of coating, this surface, which can be destroyed and dissolved when washed with soap. And this virus dies. So this virus, it settles on the inner side. The vestibule of the vagina, most often it can be unilateral. It can be the commissure, the back and its feature. A characteristic feature is the presence of such blisters. I might draw that. If we have here, let's say, the urethra, here is the entrance to the vagina, and here are the labia that connect at the back. Here, it can be like this. Oh, and here is the rectum. Most often it forms here, and the blisters that a doctor can clinically assess are of a certain size. Literally, oh, here is the scale, let's say, of such little dots. If we find such little dots, we find in this form, in the amount of, well, I don't know, 2, 10, 15, 20 blisters like these in German. This is called a blister, like a glowing one on its own. And if that spot hurts, we can be practically 90% sure that there has been an infection with the herpes virus. This virus, before it manifests as such blisters, has to incubate, meaning it has to multiply in some way. Multiply. And it takes from, let's say, 7 to 14 days, but it can vary. From that moment, the virus is still, you could say, infectious for about 2 weeks, after which it penetrates those cells and superficially disappears. Our body, if we have good immunity, produces antibodies, and these antibodies effectively destroy the virus and provide a certain form of protection. Currently, there are no preventive vaccines that could protect us from this virus. However, a good immune system and proper nutrition help prevent these viruses from multiplying Interestingly, this virus mainly affects people with underlying health conditions. At the time of sexual maturity, which for girls is from the age of 15 to 50 of life, after 50 years of age, I must say that I very rarely see viruses. Maybe because there are so many of them, maybe because the patients are no longer sensitive enough to pain, or maybe they have simply had so many viral infections that the antibodies simply cover up so much of the ailments, you could say, that nothing happens. So the most important clinical feature is simply pain. This is very important, and you need to remember it. Of course, in men, these viruses can also be transmitted through the penis, and there are also such symptoms. Additionally, one of the relatively rare symptoms is a strong urge to urinate. Also, such stinging can lead to local inflammation of the urethra or cervix, but that's relatively rare. So the best protection is simply to follow absolute rules, hygiene. And if we've mastered that hygiene and have a partner, you could say not necessarily certainly. Sexual intercourse should only and exclusively be done with a condom. This is basically the safest method, which, in a sense, you could say protects us 90%. This virus, of course, spreads through contact from one genital organ to another, as well as through the hand. And this is a very important matter. And that's why, for example, a pregnant woman who has such herpes, it's said that it's better to resolve it with her pregnancy is in the form of a cesarean section, not a delivery, because the baby can simply, viruses take over. A very important thing is, and if the patient has this virus multiple times, HSV, it's like this herpes virus, it will become less and less harmful. The treatment of choice is pain therapy and antiviral therapy. You can, of course, use less effective tablets. Here, in Germany, where we are currently, we most often just administer a medication called acyclovir in the form of an infusion. And this is done in the hospital. The patient simply stays in the hospital for so long. How long does this? The virus still causes discomfort. Of course, pain relief. However, I can tell you as a fun fact that you can also treat this virus locally, maybe not necessarily using so-called medications advertised for intimate infections, because really they don't do much, let's be honest. But if we have, let's say, some form of concentrated alcohol or isopropyl alcohol, which I really like, you can just use a cotton swab to touch those areas locally. You can also use concentrated lactic acid. I read about lemon balm, so various methods are also effective. What else could be said? Well, simply, it's a very common infection, and the main rule is simply hygiene. Thank you very much.